Okay, so this is the second part of the video I was talking about. Um, After going through hell in Minnesota, um, in a previous video I mentioned that the neurologist did not listen to me whatsoever. I now have proof of that. I am going to be calling the Mayo Clinic and talking to the board of directors, the board of whoever I've got to talk to. I'm going to be calling the medical board, everybody. If I have to, I will obtain a lawyer. I'm going after his medical license. I am going to try my hardest to make sure he can no longer practice medicine. Because he shouldn't be allowed to. He dismissed me before he even began talking to me. He said that he looked over my medical records that I gave him. If he did, he barely did. And he just didn't care about me. He didn't care anything about me, anything I had to say. Any question I asked, he got totally wrong. And I have proof of it. I'm getting ready to read you the proof. I was very pissed off when I wrote this report. Very pissed off. First off, this is false documentation. Second, this is just stupid. I mean, it's just stupid. I can't believe what he put in this report. But like I said, I'm going to be calling whoever I have to make sure that he can no longer treat patients. Because right now he's probably treating somebody right now. And that scares me. Because they're going to be going through the same hell. He treated me and tested me based on what he thought. And this is what he thought. This is his report. Chief complaint, purpose of visit, muscle spasm and syncope. Now the only reason why that's correct is because that was filled out by my doctor. So that's the only reason why that's correct. History of present illness. Now this is what he wrote. Miss Conway is a 26-year-old right-handed lady who attended clinic accompanied by her mother today. She reports that she was last well in November 2013 when she had a spider bite on her right wrist. So far correct. She has had a spiraling number of health problems since then. So far correct. Her main problems in order of priority that she outlines to me is, and now this is incorrect, because I didn't know we were doing this whenever he was having me tell him my problems. I didn't know he was having me list them in priority. Muscle spasms, pain, and he sure as shit did put palpitations when I told him tachycardia. Remember in one of the videos, we went back and forth for a good couple minutes. I said tachycardia, not palpitations. The palpitations didn't cause me to pass out at work, causing me to go on medical leave. It was the tachycardia. So, that's incorrect. Forgetfulness and weakness. Well, number one, the muscle spasms. That takes care of the pain and weakness. So it should be in this order. It should be tachycardia, muscle spasms and weakness / pain, fatigue, memory problems, and lack of concentration. That's how it should read. But again, he didn't listen to a fucking word I said. Now this is where I started crying and called my mom. This paragraph right here. She reports that in July 2014 she developed muscle spasms, which she described as constant pain in both wrists. This can be superimposed exacerbations. She has had 4 spasms this last month with severe pain in the wrist. Therefore, it cannot be a typo. He typed it twice. In my wrist. My wrists. I would not be going to the Mayo Clinic for pain in my wrists. I'd be going to the hand doctor for carpal tunnel. She crushes her medications and takes them when she has severe pain, which seems to help. He took that totally out of context. She showed me a video of her on her phone having one of these episodes, which he only watched about 30 seconds of. She appeared in severe pain with her elbows flexed. She was responsive and conversant with her mother. Occasionally during the video, she would shout out in pain. Well, it's because I was holding my breath because I was in pain. Okay, so what it should read is, she reports in July 2015, she developed muscle spasms, which she describes as a constant pain in her ribs. This can be whatever. I don't know what the fuck that is. She has had, and I said 5. I had my 6th one later on that night. She has had 5 spasm episodes in the last month with severe pain in her ribs. She crushes her medications to take them during the episodes. Only during the episodes. To shorten the length of the episodes. She showed me the video, of which I only watched 30 seconds of one of her episodes. That's how it should read. I don't crush my medication and take it like that regularly. And I explained that to him because he asked me, why do you crush it? Well, any fucking doctor or anybody in the medical field knows that if you crush your medication, it takes a lot less time for it to hit you. I wasn't snorting it. I was taking it by mouth, like it says on the bottle. I just happened to crush it so it would hit me faster instead of waiting 45 minutes for it to dissolve and hit me and take effect. So that I didn't have to go to the hospital. Only during the episodes did I do this, and I explained that to him, and he still treated me like an addict. Especially whenever he mentioned that I was going through withdrawal because somebody in the office made a boo-boo and told me not to take my medication. No, I was in pain. I wasn't going through withdrawal. You don't go through withdrawal that quick on that type of medication. She reports headache occurring, and no, it's not a headache. I was diagnosed with migraines. They're actual migraine headaches, not just headache. Okay. She reports headache occurring 1 to 2 days per month, lasting 1 to 2 days at a time. It is associated with nausea, photophobia, phonophobia, movement sensitivity, and is throbbing and consistent in character. It was previously 15 to 20 days per month. She was commenced on zonisamide 2 years ago, and this improved her headache. Other medications which she had previously been on for headache, and then he listed them. But he put gabapentin, which I was on gabapentin for my headaches. I was put on gabapentin for what they thought was fibromyalgia, which didn't work because I didn't have fibromyalgia. So he somewhat listened to that. But the migraines aren't related to this. The migraines are from a car wreck that I had. I had migraines associated with PMDD when I was a child, but they went away after my pregnancy, and I would only get them every once in a while until I had a car wreck. And of course, I used too big of words for him. I said left hemispherical migraines, and he looked at me for a second, and he said, well, who diagnosed that? I said, my neurologist back home that I used to see. I didn't diagnose it myself. I'm sorry if I used too big of words. She describes sleep disruption and reports she is on a, and puts in quotes, third shift schedule. She does not sleep at night. She sleeps for approximately 6 hours during the day and then naps for further 3 hours in a broken fashion. I told him I couldn't describe my sleep. I said I just nap whenever. I said it depends on how much pain I'm in, what I need to do the next day. It just depends. It depends on how much pain I'm in, really, and what I have to do. If I have something I gotta do the next day, I'll sleep that night. If I don't have anything to do, I may stay up and do stuff during the night, or clean if I feel like it. It just depends on how I feel and what I have to do the next night. And of course, he didn't. No. She reports that she was previously diagnosed with bipolar disorder and was treated with many medications, including, and then he listed them all. She reports in 2006 she was commenced on bupropion in the postpartum period and had a seizure event 2 weeks after starting it. I told him I was iffy on how long it was after I had the seizure. So it pisses me off that he actually put when it was, because I told him I wasn't sure. She reports that when her heart rate goes up fast, she will collapse. Now, what kind of fucking doctor, first off, words it that way? And I told him that I was diagnosed by my cardiologist with POTS, with orthostatic tachycardia. I was diagnosed with this. When my heart rate goes up too high, I will pass out. Not collapse. KO. Pass out. So that sentence just pisses me off. One, because of the grammar Nazi in me. Because he wrote it like a 5-year-old. When her heart rate goes fast, she will collapse. And for 2, no, it should read, she reports that she was diagnosed by her cardiologist that she has orthostatic tachycardia, and when her heart rate rises, she will pass out, and has done so several times in the past. Because I have. She wears a heart rate monitor to ensure that her heart rate does not rise. She has been using a wheelchair for the past month and a cane for the past 2 months, primarily because of pain. No. Primarily because my muscles don't want to work. And I can't hardly move them to walk. And also because of the tachycardia, it's hard for me to stand up for long periods of time. And I told him this. She has not been working since November 2015 because of her symptoms. She has had normal sleep study 2 months ago. That part he actually got right. But it pisses me off that I use the wheelchair and cane because of the pain. No, I don't. I've been having pain for the past 2 years. I use the wheelchair and cane primarily because my heart rate increases very dramatically when I'm upright. So for long walks, I have to use the wheelchair. And the cane helps me when walking up the stairs and up hills. So, yeah, he didn't listen to me at all on that. So let's continue, shall we? She has seen 3 neurologists, Dr. Seipel in New Albany, who diagnosed her with migraine and sleep paralysis. He got that right. She saw Dr. Luau in New Albany, who diagnosed her with migraine, and commenced her on zonisamide, which improved her headache. Got that correct? Now this one's hilarious. She has seen Dr. Pilati in the University of Louisiana, Louisville. So in the University of Louisiana in Louisville, and is due to see her back again. I didn't know that Louisville had the University of Louisiana. It's going to be interesting to find. Again, not listening. I was sitting literally maybe 6 inches, because he for some reason was very adamant on sitting very fucking close to me. Like, he had boundary issues, okay? This dude had fucking boundary issues, okay? Fucking boundary issues. He was sitting like 6 inches from me, okay? I couldn't even have stuck my arm out without touching him. He was less than an arm's length. Let's just put it that way. He could have easily heard University of Louisville in Louisville. He heard that it's in Louisville, so he should have heard University of Louisville. When I say Louisville, I say Louisville. So no way does Louisville sound like Louisiana. See, you hear the difference when I say Louisiana? Louisiana, Louisville. That's how I pronounce each word. Louisiana, Louisville. He wasn't fucking listening to a word I said. I don't know what the fuck he was thinking of when he was writing this shit down. I don't know where his mind was, but it wasn't with consulting me. It was not with the consultation on me at all. It was not. It couldn't have been. And is due to see her back again. She also attends a pain specialist, Dr. Ames, and I told him how to spell his name, and he spelled it incorrectly. Again, I don't care that he spelled it wrong, but it's the point that he wasn't listening. He spelled it A-M-E-S. I told him it's A-I-M-E-S. In the pain clinic in Jefferson, Indiana. I told him in Jeffersonville. Jeffersonville. You can hear the ville at the end. Again, not listening to me. Indiana. Dr. Ames has prescribed her Lortab. She has also seen a rheumatologist, Dr. Eson. He spelled it right because I had to spell it 3 times for him. Dr. Eson has diagnosed her with overlap syndrome between inflammatory arthropathy and fibromyalgia. That's incorrect. I told him that Dr. Eson didn't diagnose me with anything, that he was treating me for lupus because I had a slightly positive ANA, and then the ANA came back twice negative. The Dr. Eson didn't diagnose me with anything. So that whole thing is incorrect. I've actually never been diagnosed with fibromyalgia. I told him that a few people and a few doctors in the past have tried to diagnose me with fibromyalgia, and I wouldn't accept that diagnosis because I don't think it's a diagnosis, it's a symptom. And I'm very adamant on that. And he speaks about that too. But I told him Dr. Isan didn't diagnose me with anything. And he specifically asked if he diagnosed me with anything. I said no, he just treated me for the lupus. So that whole thing right there is incorrect. So I don't know where the overlap syndrome between the inflammatory, I don't know where any of that came from. That was never spoke to about. I don't know where the fuck any of that came from. She shared concerns about the diagnosis of fibromyalgia, as she feels that this is a symptom rather than a diagnosis. For one, I've never been diagnosed with it. People have tried to diagnose me with it, but I won't accept it as a diagnosis. And the only doctors that tried to diagnose me with it, I no longer see, for one. And for two, they were Dr. Chow and a few other doctors. I can't even remember which ones they were that did it. But Dr. Hassan, the rheumatologist that I recently saw, he never once even mentioned fibromyalgia. Never once even came out of his mouth. Which is hilarious. So, she reports that her primary care provider, Dr. Crow, has prescribed her baclofen and clonazepam and Flexeril. She currently attends a therapist for management of her mood disorder. That is incorrect. I told him, because I don't have a mood disorder, for one. For two, I told him that I go see my therapist for my environmentally induced depression. That I no longer have bipolar disorder, that I was re-diagnosed. I have borderline manic disorder. I do not have clinical depression, and I have environmentally induced depression caused by me not being able to work and doctors like him that don't listen. So that's totally incorrect. I don't have a mood disorder. I have anxiety, but I don't have a mood disorder. So that's incorrect. One of the main reasons for her attending here was because of a recent MRI brain performed by Dr. Pilati demonstrating arachnoid cysts. That is incorrect all in itself. I had this appointment made before I even got the results back from the MRI, and actually I'm pretty sure I had the referral sent before I even had the MRI. So that whole thing, so the whole basis of my treatment at the Mayo was under false pretenses. So I technically wasn't even treated at the Mayo Clinic correctly at all. So all that money, all that time, everything was wasted. They were concerned that the arachnoid cyst may be causing her current symptoms. Yeah, we were, but that's not why I went to the Mayo Clinic. So then it just says my current medications and everything. Then he says my social history, which he took down wrong, but he says she smokes 40 cigarettes a day. I said I smoke up to 2 packs a day. I said I used to smoke less than a pack a day, and now because of the pain medication, and me sitting around not being able to do anything and being off of work, I smoke up to 2 packs a day. But he just put she smokes 40 cigarettes a day. And then my family history, he got most of it right, but some of it he didn't put down right. So that tells me he didn't listen. It's just the amount of brothers and sisters I have, he didn't put down right. So that tells me, again, he didn't listen. Physical examination. He put that she has tender trigger points, in all areas suggestive of fibromyalgia. I knew that's what he was doing. Whenever he was doing the trigger points, I knew that's what he was doing. It's bullshit. Okay, I may have fibromyalgia, but fibromyalgia is a symptom of something. It's not a diagnosis. You can say I have fibromyalgia. I don't give a fuck if you do, but it's a symptom. It's not a diagnosis. Then he says, under the impression, report, and plan, he diagnosed me with chronic pain syndrome, and diagnosed me with orthostatic intolerance. And then he puts that there was an outside diagnosis of inflammatory arthropathy and fibromyalgia, which is incorrect. I was never diagnosed with any of that. And there's an outside diagnosis of bipolar disorder. That's incorrect. I don't have bipolar disorder. So I have chronic pain syndrome and orthostatic intolerance, which that's incorrect because I was already diagnosed with orthostatic tachycardia. Again, he didn't listen. This is and then recommendation, he just listed all the things that he was going to test me for and all the labs and everything. So Miss Conway presents with myofascial pain and in the context of severe functional decline over the last number of years. She is keen to have neurological or autoimmune condition excluded and feels that her home providers have not adequately addressed this for her. I've discussed with her that her presentation is a common presentation which we see. However, I would be happy to address her concerns thoroughly. To this end, I have ordered the above evaluation. I've discussed with her that these are likely to be low yield, but hopefully will help with excluding the disorders she is concerned. About. Hopefully, our rheumatology colleagues can separate out any inflammatory arthropathy. I don't know if I'm pronouncing that right or not. Component from any fibromyalgia component. I think she may benefit from the pain rehabilitation program, which I kept telling him that I can't go to another pain rehabilitation program because that will interfere with my pain management and I'll lose my pain management here, and he wouldn't listen to me. He kept saying, well, I think you'll really benefit from this. We'll just go ahead and schedule you an appointment. Which later on I canceled. I called and told the desk, I said, well, if I go to this, for one day, because I'm only going to be here for one day, I said, it sounds pretty stupid for me to go to your all's pain management for one day and then go back home and not have pain management and not be able to get the medication I need just because I went to your all's pain management for one day. And she was like, oh, no, that sounds silly to do. Why? I don't understand why he'd want you to do that. So she canceled the appointment for me. And whenever I called to tell them how horrible he was to me and how he didn't listen, they didn't seem surprised at all. I think that she was happy with the plan. No, I wasn't. I was very upset. I will visit back with her with the results about the evaluation. And then, with his follow-up, he puts, I called Miss Conway today to follow up with her following her evaluation. She was seen by me on March 10th, 2016. I did ask the desk to offer her an in-person evaluation, but she was unable to attend. I was never offered an in-person evaluation. Because if that had been done, I would have attended. Trust me, I would have stayed another day to attend that. Because I would have loved to tell him to his face how I felt. Since I've seen her, she has had and just tells me the tests and everything. Anyways, whenever he called me, that was just the main part I wanted to tell you about, was that he supposedly had the desk offer me to come in for a follow-up visit. Well, I specifically called to have a follow-up visit and couldn't have one. So that's a flat-out lie right there. So, yeah. So anyways, when he calls me to tell me everything, he tells me that the only problem I have is that I don't sweat on top of my hands, on my feet, and the side of my elbows. I don't give a fuck. I don't give a fuck that I don't sweat on top of my knees and my hands. I mean, what the fuck does that mean? And of course, he doesn't tell me what that means. But the doctor who read that study saw the medications I was on and said that it could have been medication induced. So of course, my neurologist runs with that and says, now he changes his story and changes his story from my depression causing my sickness to my medication causing my sickness. And in my previous video, I know I ranted a little bit about me being a fortune teller and, me going to the doctor and saying, okay, I'm going to have these symptoms, so give me these medications. And the doctor actually gives me these medications, and then I take them, and then they give me the symptoms. That just doesn't happen. That's fucking stupid. The medication doesn't give you the symptoms. You take the medication for the symptoms. Trust me, if I didn't have to take these medications, I wouldn't. I don't like taking umpteen million fucking pills a day. I don't like doing that. I don't like being in pain. I don't. It's not pleasurable for me. It's not. I don't like being off of work. I don't like having to have Andrew being the only person bringing money. I hate how he has to go to work every day, and I see him working his ass off and being tired all the time and being stressed out about money and going to work, and meanwhile I'm sitting on my ass doing nothing and not bringing in any money because I can't fucking work. Yeah, I'm just fucking loving it. Let me tell you. But apparently, if I just stop taking all my medication, it'll fix everything. So that's when I got pissy with him and said, I said, well, I take my medication because of the symptoms. And what I should have said was, so if I stop taking all my medications, my symptoms will go away. And I really should call him back and ask. Whenever I call, I should ask, so when I stop taking all the medications, my symptoms will go away, right? I'm going after his medical license. He should not be allowed to perform medicine. I don't know who gave him his license, but he must have been a C student because I don't know. I don't know who fucking hired him at the Mayo Clinic. He should not be working there. Everybody else there was very nice, some of them lack common sense, but that was everybody I met in Minnesota. But they were very, very nice and very, very concerned and very just nice as shit. And he just didn't give a fuck. Just did not care. And it was just ridiculous. And then he writes this report that I had muscle spasms in my wrists. And it's not a typo, he typed it twice. In my wrists, really? I'm coming to the Mayo Clinic and having all these tests done because of muscle spasms in my wrists. Are you fucking kidding me? Really? He was... Oh my god. He wasn't listening to me at all. Over half that report is false. He wasn't fucking listening to me, and that just pisses me off that the whole time I was there being treated, there were other tests that probably could have been done had he listened to me. Because I was wondering why they were testing more of my limbs. Which, I mean, I get it because, it was hard for me to walk. But they were doing more tests on my limbs than they were my back and ribs and everything. And I'm like, those are my main muscles bothering me. Yeah, I mean, now it's hard for me to walk, but that comes after my rib muscle episodes. Why aren't you looking at my back muscles? My shoulders are in fucking knots. Why aren't you testing these muscles and looking at them? Well, now I know why. Because he thought my wrist muscles, these little fucking muscles right here that are insignificant, I guess, were spasming. And because I came to the Mayo Clinic because of a cyst found on the MRI. No, if it were for that, I would have waited for my follow-up with my neurologist who ordered that test. I had already had that appointment with the Mayo Clinic, and I told him that. I'm just so pissed off. They are going to fix this somehow. They are going to reimburse me for the money that I had to borrow to go there. They are going to fire him or something. They are going to do something to rectify this, because I am so pissed off that this whole trip was for nothing. Nothing was accomplished out of this trip. I borrowed and spent upwards of like almost $1,100, $1,200 and drove 15 hours there and almost 13 hours back. And we were exhausted and everything, and now I'm in more fucking pain than I was before I left because I had to have a spinal tap and all these fucking tests. For nothing. Nothing was found. The only person that did listen, luckily, was the rheumatologist. She wrote, Miss Conway was referred by Dr. Tobin for exclusion of possible autoimmune connective tissue disease. Miss Conway's history is very, very well described in an excellent note from Dr. Tobin. Of course, I'm assuming she had to put that there, because it wasn't. And I really hope she doesn't use his history. Ms. Conway is here to make sure there is no autoimmune connective tissue disease. She had a constellation of symptoms of muscle spasm, contracture, dizziness, and steadiness, POTS-like symptoms, and muscle spasm. She tells me that during all these episodes, her CRP has been elevated, and she has also had weight loss. Around July 2014, she had an ANA that was drawn and saw a rheumatologist who initiated her Plaquenil. She was on it for 7 to 8 months, but had no improvement in symptoms and stopped it by herself. She tells me that the subsequent ANAs, repeated times 2, have been negative, and the ANA at the Mayo has been negative as well. She has joint pains involving bilateral needs that are present both in the morning as well as in the evening. When she gets up, she takes her medication, which helps these baclofen, Flexeril, and hydrocodone, which helps these symptoms. She feels her knees may be swollen. She denied having any pains in her hands, wrists, elbows, shoulders, ankles, or feet. And when she says shoulders, she was talking joints. I told her that I have muscle pain in my shoulders and swollen in the muscle. So far, everything's correct. She also has a history of back pain, which involves neck, mid-thoracic as well, and low back area. Again, present both in the morning and evening. It is improved with rest as well with the above cocktail of medication. It is actually worsened with activity. Many times she has held her urine for hours so that someone can help her to the bathroom. Ibuprofen seems to help this pain as well. Wow, it's amazing. A doctor that can listen. And, her social history, she put on correctly. She even described that I'm a, security officer that's been off work since November 2015. Oh, and the diagnosis, myalgias, not fibromyalgia, myalgias, elevated CRP, and low back pain. She got it right. Those are her impressions. Diagnoses, myalgias, elevated CRP, and low back pain. So she didn't make shit up. Discussed with Miss Conway that with the negative ANA 3 times, she does not have lupus. I am not getting a clear sense of her joints, if her joints are inflammatory or not. However, with the elevated CRP response to prednisone dose pack, we need to exclude an inflammatory rheumatic process. Rheumatoid factor CCP is negative here, but for completeness sake, I will obtain a joint scan, which unfortunately I couldn't do. She has some low back pain, although there is more non-inflammatory character to it, but will, with a mild elevation in CRP history of 8.2 here, I will get a MRI, so that's when she got the low back MRI. If workup here is negative, it is certainly reasonable to treat her symptomatically as fibromyalgia, but I do not have a clear explanation of why the CRP should be elevated. However, I did not have any outside medical records to corroborate that or to see if there was a secondary process contributed to it, which was my fault. I didn't bring her the medical records because we were in a hurry to get in there and everything. So, but she even goes into detail to explain that, she's wanting to roll out things. He, on the other hand, just didn't fucking listen to me at all. So, like I said, I am going to be calling the Mayo Clinic, and they will be fixing this. Whether they have to send me back to another Mayo Clinic, expenses paid, of course, and reimburse me for all of my expenses for this one, or whatever they have to do, because it's pretty much like I just took $1,200 and flushed it down the toilet and never went to the Mayo Clinic. That's pretty much, because the only test that they did that I wanted done that hadn't been done here was the spinal tap. And I don't even know if they've tested it for everything that I wanted them to test it for. So I'll have to look into that as well. Because I told him what diseases I wanted ruled out. Of course, I'm sure he didn't listen to me on that either. So it was a waste. It was a waste of money. It was a waste of time. It was a waste of trip. It was as if I didn't even fucking go to the Mayo Clinic, and I just took $1,200 of everybody's money and just fucking flushed it down the drain, and got treated like shit at the hotel too. The hotel was trying to get $100 out of me, and they're not getting it. They didn't enforce the $200. They didn't make that man pay $200 for illegally parking in the handicap spot. They're not getting $100 out of me for smoking in the hotel room. I left the hotel room cleaner than it was than whenever we got in there, and it smelled like smoke when we got in there, and it stunk like something died in there. When we were in there, we were constantly having to spray perfume and Febreze in there. So, yeah, they're not getting any fucking money from me. I called my bank and told them that I didn't authorize it. So I got that money back pending this investigation. And I canceled my debit card so they can't take any more money out. And I told the lady that I don't authorize them to take any money off my card. And she did it anyways. And they're not getting any money out of me. Like I said, we left that room cleaner and smelling cleaner than it did when we got there. My mom stepped on a piece of glass on the carpet when she was walking barefoot. If they want to take it any further, I have no problem doing so. I'll sue them because that room was filthy and disgusting, and I have pictures of it and video of it. I'll just start suing a bunch of people in fucking Minnesota. Let's keep it going. I mean, this trip was hell, and I really wish I wouldn't have gone. I wish I wouldn't have gone. There was no point of going. It was a waste of time. It was a waste of money. It was a waste of hope. They didn't do anything for me at all. And except for telling me that the backs of my hands and the tops of my knees and the tops of my feet don't sweat. That's the only thing I found out. So, yeah. The Mayo Clinic is not what it's choked up to be. Apparently I just got the one bad, everybody says it's this wonderful place. Apparently I just got the one bad doctor. So that's my luck. I got the one bad doctor that doesn't listen. So, when I get my medication, because I am too distraught to talk to them right now, since my doctor decided to let me go through withdrawal. Whenever I get my medication, I'm going to call the Mayo Clinic and everybody that I need to call, and I'm going to fight this tooth and nail until somebody listens to me, because he does not need to be seeing patients. He should not have his medical license. And if I've got to get a lawyer to sue him or whatever, I will. Because this is a false report. And this report now is going to be going to all my doctors. So, my doctors already are on the verge of not believing me and everything. And now they're going to see that I'm having spasms in my wrists, and that, that I went to the Mayo Clinic because of the cyst. And how the fuck did I go to the Mayo Clinic because of the cyst? I didn't get the labs until after I'd already gotten the appointment. Again, I'm not a fucking psychic. 3 times now he's called me a psychic. I mean, I'm going to end this rant now. Because now I've got to call and see if my insurance company has put my payment back through. I don't know how they can have the money and not apply it, and then apply it, and then it be unapplied, and then they have to reapply it. So today I'm going to be trying to get my medication and looking for new health insurance because mine fucking sucks. Because even once I pay, it goes to them, but it doesn't get applied to my account. They have to go in there and actually apply it to my account, which is the stupidest fucking thing I've ever heard. Yeah. And I'm just in a lot of pain today. And so, yeah, that's what I'll be doing today. Trying to get my medication and find new health insurance. And then tomorrow I'll be calling Mayo Clinic and everybody that I can to try to get this doctor fired and try to get my money back and sent to a facility that will actually treat me this time and not treat me like shit. So that'll be my next 2 days.